Our next guest is Lynette Pinkston, Novant Health Brunswick Medical Center's Med-Surg Department Manager. Welcome to the show today, Lynette. It's such a pleasure to have you.
Thanks for having me.
Well, good. I think I want to start by learning more about you. So tell me a little bit about your background.
Okay, I became a nurse later in life.
Did
I
you?
was a optician to begin with.
Really?
My first career, I was an optician, and I managed 3 optical labs for a large doctor's office in Salisbury.
Oh.
So I actually graduated from nursing school between when my 2 children graduated. So I was a late bloomer. So I've been a nurse about 15 years.
Oh, well, great. Tell me about your role at the hospital. What is it that you do?
Right now I'm the nurse manager for the Med-Surg department.
When did you take that role as the manager of Med-Surg?
It's been a year this month.
Oh,
So 1 year.
so still a little bit new to the
Yes.
that department.
Yes.
Well, kind of tell us what exactly is the Med-Surg department. I know that term might not be familiar to all of our viewers.
Right. We're a 50-bed medical surgical department.
50 beds?
50 beds. We take care of the adult patient who has acute illnesses, disease processes, and then we do follow-ups, post-op surgical care on the unit.
Hence the name Med-Surg. You do a little of both. Is that
Correct.
right?
Correct.
What about folks who might need a higher level of care, like ICU or PCU?
Right.
They would be somewhere else. Is that
They would be we're on the 2nd floor, they would be up on the 3rd floor.
And would there be an area that they might go to? Might they go to Med-Surg prior to being released from the hospital if they've been in ICU?
Yes, that's normally the process. We kind of joke because critical care is on the 3rd floor, we're on the 2nd.
Oh, so you kind of graduate
we
down?
tell them the closer to the ground they get, the better they're getting. There are occasions where a patient will be discharged from the progressive care unit if they're just doing fantastic and they can skip that Med-Surg stage, but most people do visit our unit before they're discharged.
Good, good. How about who takes care of them? Is the hospitalist team? Do they
Yes,
do
we
the
have
primary care?
We have
for
a
them?
great team of hospitalists, and the hospitalist, along with any specialty consults that they may have and surgeons, they work as a team to take care of the patient.
Okay. I know that you and your team have a lot going on, and I think you've got some new initiatives out there.
Yes, we
Let's
do.
talk a little bit about those.
This is very exciting for me. The initiative that is most exciting right now for us and the patient is team rounding. We have gone to a format where the primary doctor, the primary nurse, and the case manager actually round on the unit with the patient. They go in the room, and this starts at 8:30 in the morning, so family is aware that if they have questions, want to see the doctor, it's kind of, we're all collaborating together in the care for the patient. We're talking about medications, we're talking about what's working, what's not working, we're talking about discharge plans. So this is just, it's a great initiative. And we all are communicating at the same time, so everybody's on the same page.
Well, how long does it take to get through all those folks?
The doctors have, normally we have 3 to 4 hospitalists that are rounding on my floor. So we're hoping to get a little quicker. Right now, it's taken a couple of hours for everybody to be through, but we're hoping. They're spending anywhere from 10 to 20 minutes in the room with the patient. So yeah, it's taken a good while, but this is really helping bring that patient care experience to its fullest because we have the whole team there. If there's any issues, it's handled right then. The nurse doesn't have to pick up that phone and call the doctor, hey, we need to change pain medications, things like that. We're talking about it in the room, and we're including the patient if they're able to be included in the conversation.
Does the family know ahead of time that this is going to happen,
Yes,
and
they do.
they're welcome to participate?
Yes, we encourage that.
And that happens for every patient on Med-Surg?
It actually is happening for every patient, every inpatient in the hospital. We've
Really?
rolled it out on the 3rd floor too. So
Wow.
yeah.
That sounds like a great way to keep everybody involved, so then the family knows exactly what's going to happen upon discharge, what needs to happen.
Exactly. So we are very excited about this.
Well, what would you like for patients and families out in the community to know about Novant Health Brunswick Medical Center's Med-Surg department?
I would like for them to know that we care for our patients like they were our own family members. When they leave that unit in the afternoons, I want them to feel like they have just tagged another family member, you know, a tag team. I want them to feel comfortable leaving their loved ones there with us, because we truly do care for them as our own family.
That's a great way to put it. It's a great thought. Well, before we close today, is there anything else that you would like to mention?
Well, I'd like to thank you for your time.
Well, thank you. It's a pleasure.
To get the Med-Surg, a lot of people don't know about Med-Surg, and they just think it's you know, just a lower level of care, but it's really not. It's a specialty in itself. The Med-Surg nurse really has to know a lot about every system of the body to be able to be a good Med-Surg nurse. And you know, in closing, I would like to thank my team, because it is the best group of caring, compassionate people that I've ever worked with.
Great. So. Nice of you to say that. Well, thanks again for being here. It's been a pleasure. We hope to see you back soon.
Okay, thanks.